Let's talk about the COVID pandemic and how it's impacted many, if not all of us, in different ways. On the front line of it all, healthcare professionals treating and caring for all those patients. So how has healthcare changed in the more than 2 years since all this began? THV 11's Brooke Buckner spoke with medical experts here in Arkansas about their lessons learned.
Healthcare workers in central Arkansas and all over are finding their new normal with COVID. I went to a couple clinics to find out how they've adapted.
COVID has absolutely changed healthcare, and the way that it's delivered and the way patients experience care is substantially different than it was prior to the pandemic.
Nurse practitioner Joseph Finley says here at CHI St. Vincent Primary Care Clinic in Hot Springs, they're still feeling the pandemic's impact.
Over the past 6 months or so, we've seen an increase in patient interest in returning to the clinic a little bit more frequently.
Finley says that's because patients seem to be more comfortable coming inside the clinic now, like before the pandemic.
We expect that trend to continue.
One thing that's changed, though, he expects patients to keep using telehealth, which he says was an easier but also safer way to get medical help during COVID.
It's an efficient way to provide health care for people. It's really convenient typically. You don't have to take out as much time for an appointment for a telehealth visit.
As medical facilities return to a more regular workflow, they're not forgetting the lessons they learned. At St. Vincent, they're prepared to take extra precautions again.
That area specifically does exist, and they've been able to maintain that as a potential option for rapid rollout if they were to develop a rapid spread of COVID or new respiratory viruses that may come into play in the future.
The pandemic didn't just change how people got the medical help they needed, but in some cases, it changed how they handled healthcare altogether. Dr. David Gerson works at the Sherwood Family Medical Center. He says more people simply put off important appointments.
Their cancer screenings, diabetes screenings, hypertension, taking care of their hypertension. The kids that really lost several years of their developmental, meeting their developmental milestones. It's just in 2 years, it's been very obvious.
Even months after many places reopened, Dr. Gerson is still playing catch up with those patients.
These are things that are critical. 6 months, a year, it did make a difference.
He also noticed an increased need for mental health care.
I think the last statistic we saw was 500% increase in suicide attempts amongst adolescents, during the COVID pandemic, because they're just isolated. And unfortunately, a lot of providers of all levels kind of shut down.
Dr. Gerson says whether it's mental or physical help, the best thing people can do now is get the care they need.
The good news is that people are coming back, and we're finding the resources for them, and we're happy they're coming back.
COVID has been definitely difficult and has changed significantly from the initial stages of the pandemic, but overall has been really rewarding when you see patients get the health care that they need and help them improve in health generally over time.
Brooke Buckner, THV 11 News.
And Finley says another change from the pandemic, getting more medical history from patients before their appointments.